Hi, Mrs. Pope. My name is Bryce Washington, and I'm going to be your student nurse practitioner taking care of you today. I see on your chart that you have a complaint of sore throat, swelling on the side of your neck, and you have been having a fever that's been going off and on at 101 degrees. So I'm going to do a little palpation. I felt your throat, and I noticed some swelling. You still have a fever. Your fever is not as high, it's not 101, but it is about 99.8. And you also have still developing that sore throat. Your pain, you've quoted that's at an 8. And I've decided, and I've looked in your throat, and I've noticed that there is some redness in the back of your throat. So I decided to perform a rapid strep test on you. And I sent it off for it to be tested, which usually takes about 20 minutes. So I just got the results back, and it is positive for strep. Given that you have a positive strep culture, that is telling us that you do have a bacterial infection known as strep, I'm going to prescribe you clindamycin, 300 milligrams by mouth every 6 hours for 10 days. The reason why I prescribed you clindamycin is because of you are allergic to penicillin. So you might be wondering, how does clindamycin fight your infection? So given that strep is a bacterial infection, clindamycin is an antibiotic that is used to prevent that bacteria that's currently in your throat from reproducing and spreading throughout the body. So clindamycin will therefore kill it. And how clindamycin will work in your body is that it works best when it is taken by mouth, and it can reach the site of infection usually within about 50 to 60 minutes, usually around an hour. We're gonna say an hour, and it will then proceed to then slow down or stop that growth of that bacteria, eventually killing it and then preventing any regrowth from happening anytime in the future. It is broken down, by your liver in order to achieve its destination, and then it's usually leaves your body through your poop or your pee. You won't notice it. It's completely undetectable. That's what happens when you ingest it in your body, usually through your mouth, and usually it works its way down until it comes out the other end usually. So clindamycin, the common side effects of it usually is you might have some experience of nausea, some vomiting. If we give you the oral kind, if you prefer oral, liquid kind, you might have developed like a bitter taste, like a metallic taste in your mouth for a couple of days. But if you decide to want the pills instead, or the capsules, you won't have that bitter taste, but you will experience like nausea, vomiting, maybe an upset stomach. You may experience like a headache or some dizziness, but these usually are all common side effects of this type of drug. So excuse me, so sorry. When taking clindamycin, you don't want to take any more of it, and you don't want to take any less of it. You want to take it as I have prescribed for you, that you're going to pick up at your pharmacy. You're going to take it every 6 hours. It's going to be 3 times a day. So take it morning, noon, and night. Okay, and you're going to take that every single day, either at the same time, or at least maybe you can be a little bit off on your time, but at least give it in 3 times a day. We're going to do it for 10 days. Okay, and you're going to take it with food. Taking it with food will lessen the risk of developing an upset stomach, and then taking also with a full glass of water is also desired, because taking with a full glass of water will help prevent any irritation in your throat, because that can occur with this antibiotic. After you take it, please do not lay down. In order for this medication to achieve and reach its destination, which is to get to that infection, you want to not lie down, because that can prevent it can prevent it from reaching in your stomach in order for it to be digested and then be able to be broken down and be able to work. So if you can just hold off on lying down for at least 30 minutes, sit up, sit up or stand at least for 30 minutes, that will be great in order to prevent, in order to help that pill to be able to pass through your system and be able to get to it to work. When taking it, please do not chew or crush this pill. It has to be taken whole. You will feel better within a few days after taking it. But I do advise that you please continue to take this medication, because until you're completely done with the bottle, until it's completely empty, even if you do feel better, because skipping or stopping may result in this medication not completely killing the infection and then regrowth, and then the infection can return, or it cannot die off, and then you still have more symptoms, and then you're not getting any better. Okay. If your symptoms do not get better, your fever worsens, or you start to experience worsening side effects like the dizziness, nausea, the vomiting, upset stomach that does not go away even though we take it with food, or you start to have like diarrhea, do not hesitate to contact us. We will probably change out your antibiotic. We don't like to do that, but even if the side effects do worsen, we do want you to take another antibiotic, and there are other antibiotics that can help treat this strep bacterial infection for sure. So please do not hesitate to contact us if any of your symptoms do worsen, or you feel like you're just not getting better. Come on in, make an appointment, and we'll get you taken care of. Okay, Mrs. Polk. Regarding any special considerations regarding pediatrics and elderlies regarding clindamycin, it is safe to take, to prescribe this antibiotic, as it can fight many serious bacterial infections in the pediatric and the elderly. With the pediatrics, dosage is usually calculated through body weight. It is given mostly as a liquid medication, as small children have an increased risk of choking, especially with those smaller pills or capsules. Side effects are usually the same as with adults. It's the same as going to be seen with kids. Usually they're giving them more of the liquid version, and that can usually leave a bitter, nasty taste in the kid's mouth. So usually that's the side effect that's usually seen most often. On the other hand, older adults are prescribed the same dosage as the younger, between 150 to 300 milligrams every 6 hours, with the highest dosage being about 450 milligrams. Same side effects as with older adults. There have been no studies that have said that clindamycin should not be given to the elderly, or it's limited in its usefulness in the elderly, so it can be used. It can be used in the elderly population as with the younger generation. Moreover, given diarrhea is more prevalent in the elderly community and is less likely to be tolerated, this medication would really not be the top choice for the recommended antibiotic therapy for any type of bacterial infection if prescribed. And then if it is prescribed because maybe the patient has a penicillin allergy, like with Ms. Pope, then it will require more caution, and then dosage adjustments will be needed for this medication.